In the context of dental hygiene, explain how the principles of autonomy, non-maleficence, beneficence, justice, and veracity can create ethical dilemmas. Provide examples of how a dental hygienist might navigate a situation where these principles conflict. Answer: the principles of ethics are fundamental to dental hygiene practice. Autonomy refers to the patient's right to make informed choices about their treatment. The conflict may arise when a patient refuses a recommended treatment and the hygienist believes it is in the patient's best interest. Non-maleficence is the duty to avoid harm. If a treatment poses a risk, the hygienist must weigh the benefits against potential harm. Beneficence requires the professional to act in the best interest of the patient. This can create tension if a hygienist believes a treatment is beneficial but the patient disagrees. Justice involves fairness in providing care. A scenario may arise where a hygienist must prioritize limited resources for multiple patients. Veracity is the obligation to tell the truth. Misleading a patient about treatment risks can lead to ethical violations. For instance, consider a scenario where a patient opts not to undergo a fluoride treatment due to personal beliefs. The hygienist must respect the patient's autonomy while also ensuring that they understand the potential consequences of their decision. Beneficence. What are the ethical implications of conflicts of interest in dental hygiene practice, and how should a dental hygienist handle a situation where a personal relationship could influence patient care decisions? Answer: conflicts of interest arise when a dental hygienist's personal interests potentially interfere with their professional responsibilities. Ethical implications include integrity. Maintaining trust in the patient-provider relationship is crucial. Any perceived conflict can erode patient confidence. Transparency. Hygienists must disclose any personal relationships that may affect their decision-making, ensuring patients are informed. To manage this situation, the hygienist should disclose the conflict, inform the patient about the personal relationship and how it may affect care. This transparency can help maintain trust. Refer to another provider. If the conflict could compromise the quality of care, referring the patient to another provider can be a prudent step. Document the situation. Ensure that the conflict and any actions taken are documented in the patient's record, adhering to ethical guidelines and best practices. The American Dental Hygienists Association (ATAP) Code of Ethics emphasizes that professionals must avoid situations that compromise patient care. Discuss the importance of understanding state and national regulations governing dental hygiene practice. How can failure to comply with these regulations impact a dental hygienist's career? Answer: understanding regulations is crucial for several reasons. Scope of practice. Each state defines the scope of practice for dental hygienists, including permitted procedures and tasks. Misunderstanding these regulations can lead to unauthorized practice, resulting in disciplinary actions or loss of licensure. Licensing requirements. Dental hygienists must meet specific education and continuing education requirements to maintain their licenses. Non-compliance can lead to license suspension or revocation. Legal accountability. Hygienists are legally accountable for their actions. Ignorance of regulations can lead to malpractice claims or legal action against them. Failure to comply with these regulations can severely impact a hygienist's career by damaging their reputation, incurring legal fees, and possibly leading to loss of employment. Adhering to state and national guidelines ensures safe and ethical practice, thereby protecting both patients and practitioners. Mr. Thompson is a 70-year-old patient who has been diagnosed with advanced periodontal disease. He refuses deep cleaning and any further treatment due to anxiety about the procedures. As his dental hygienist, how should you address his concerns while adhering to ethical principles? Answer: in this scenario, the dental hygienist must balance the ethical principles of autonomy and beneficence. Respect autonomy. Acknowledge Mr. Thompson's right to refuse treatment. Ensure he understands the consequences of not receiving the recommended care. Educate and communicate. Engage in a dialogue to understand his specific anxieties. Offer reassurance and detailed explanations about the treatment process, potential outcomes, and available pain management options. Offer alternatives. Explore alternative treatment options that may be less invasive, allowing Mr. Thompson to feel more comfortable. Document the discussion. Thoroughly document the conversation in the patient's record, including his concerns, your explanations, and his refusal of treatment, which is essential for legal protection and ethical accountability. This approach respects Mr. Thompson's autonomy while also fulfilling the hygienist's duty to promote beneficial health outcomes. Explain the significance of patient confidentiality in dental hygiene practice. What are the potential legal ramifications if a dental hygienist violates HIPAA regulations? Answer: patient confidentiality is a cornerstone of ethical practice and is legally protected under the Health Insurance Portability and Accountability Act (HIPAA). The significance includes trust. Patients must trust that their personal health information will be kept confidential, encouraging them to disclose sensitive information necessary for care. Professionalism. Upholding confidentiality demonstrates the dental hygienist's commitment to ethical practice and patient respect. Violating HIPAA can lead to severe legal ramifications, including fines and penalties. Civil penalties can range from $100 to $50,000 per violation, depending on the severity of the breach. Criminal charges. Willful neglect can result in criminal charges with penalties including imprisonment, loss of licensure. Violations may also lead to disciplinary actions from state licensing boards, including loss of licensure. Discuss the importance of lifelong learning and continuing education for dental hygienists. How does involvement in professional organizations enhance a dental hygienist's career and practice? Answer: lifelong learning and continuing education are vital for dental hygienists for several reasons. Evolving practices. The field of dental hygiene continually evolves with new research, technologies, and treatment methodologies. Ongoing education ensures practitioners stay current with best practices and advancements. Licensure requirements. Most states require continuing education credits for license renewal, making it a professional necessity. Enhanced competence. Continued learning fosters a deeper understanding of complex dental issues, improving clinical skills and patient care. Involvement in professional organizations, such as the NBDHE, enhances a dental hygienist's career by networking opportunities. Organizations provide a platform for networking with peers and mentors, facilitating knowledge sharing and career advancement. Access to resources. Members gain access to resources such as research, workshops, and conferences that promote professional development. Advocacy. Professional organizations advocate for the profession, influencing policy changes that affect practice standards and regulations. Analyze a scenario in which a dental hygienist discovers that a colleague is performing procedures outside their scope of practice. What steps should the hygienist take to address this situation ethically and legally? In this scenario, the dental hygienist faces an ethical and legal dilemma. The steps to take include document observations. The hygienist should carefully document the specific procedures being performed and the context in which they occurred. Consult relevant policies. Review the state regulations and the dental office's policies regarding the scope of practice to confirm that the colleague is indeed overstepping boundaries. Address the colleague. If appropriate, the hygienist could first approach the colleague in a private setting to discuss their concerns. This conversation should be respectful, focusing on patient safety and professional integrity. Report to management. If the issue persists or is severe, the hygienist must report the situation to the supervising dentist or management. This is critical to ensure patient safety and compliance with legal standards. Understand whistleblower protections. Familiarize yourself with whistleblower protections to ensure that reporting this issue does not jeopardize your position. Ethically, the hygienist has the duty to protect patient safety and uphold professional standards. Failure to address the issue could lead to legal repercussions for both the colleague and the hygienist, highlighting the importance of accountability in the profession. Discuss the importance of informed consent in dental hygiene practice. What elements must be included to ensure that consent is truly informed, and what are the legal consequences of failing to obtain informed consent? Answer: informed consent is a crucial legal and ethical requirement in dental hygiene practice, ensuring that patients understand and agree to treatments. Essential elements include disclosure of information. Patients must be provided with comprehensive information about the proposed treatment, including its nature, benefits, risks, and alternatives. Understanding. The patient should demonstrate an understanding of the information provided. This may involve asking questions and receiving clear answers. Voluntariness. Consent must be given voluntarily, without coercion or undue influence from healthcare providers. Capacity. The patient must have the mental capacity to make informed decisions. Special considerations are necessary for minors or individuals with cognitive impairments. Legal consequences for failing to obtain informed consent can include malpractice claims. Patients may pursue legal action for malpractice if they undergo treatment without proper consent and experience adverse outcomes. Disciplinary actions. Dental hygienists may face disciplinary actions from state licensing boards for not adhering to informed consent protocols. Loss of patient trust. Failing to obtain informed consent can erode trust in the patient-provider relationship, impacting future care. Understanding and implementing informed consent processes is vital for maintaining ethical standards and legal compliance in dental hygiene practice. How do ethical responsibilities extend to public health initiatives within dental hygiene? What role do dental hygienists play in advocating for community health, and what ethical considerations must be taken into account? Answer: ethical responsibilities in public health initiatives require dental hygienists to advocate for the overall health of communities. Their roles include education and outreach. Hygienists educate communities about oral health, preventive care, and available resources, promoting better health outcomes and advocacy. Hygienists may advocate for policies that improve access to dental care, especially for underserved populations. This includes participating in public health programs and initiatives, research and data collection. Collecting and analyzing data on community health trends enables hygienists to identify areas of need and support evidence-based practices. Ethical considerations include equity. Hygienists must advocate for equitable access to dental care for all populations, ensuring that marginalized groups receive appropriate services. Cultural sensitivity. Understanding and respecting cultural differences is crucial when developing public health initiatives to ensure effectiveness and acceptance. Informed consent in community programs. Public health initiatives often involve educational programs and screenings. Describe the legal and ethical implications of delegating tasks within the dental hygiene practice. How should a dental hygienist determine what tasks can be appropriately delegated and what considerations must be made? Answer: delegating tasks in dental hygiene practice must adhere to legal and ethical guidelines. State regulations. Each state defines what tasks dental hygienists can delegate to other staff members. It's critical to be familiar with these regulations to ensure compliance. Assessment of competence. Hygienists must assess whether the individual to whom they are delegating the task possesses the necessary skills and training to perform it safely and effectively. Patient safety. Any delegated task must not compromise patient safety or quality of care. The hygienist remains responsible for the overall care provided, including tasks delegated to others. Ethical considerations include informed consent. Patients should be informed about the delegation of tasks and the qualifications of those performing them. This fosters transparency and trust. Professional accountability. Hygienists must ensure that delegation does not diminish their responsibility for patient care. They must supervise delegated tasks appropriately. What are the key components of effective oral health policy, and how do they influence community dental health outcomes? Provide examples of legislation that supports these components. Answer: effective oral health policy comprises several components, including access to care, prevention strategies, health education, and financing. These components influence community dental health outcomes by ensuring that populations have the necessary resources and knowledge to maintain oral health access to care. Policies should facilitate access to dental services for underserved populations. For example, the Affordable Care Act expanded Medicaid coverage to include dental care for children, improving access for low-income families. Prevention strategies. Legislation that promotes preventive measures such as fluoridation of public water supplies and school-based sealant programs directly impacts oral health. The Children's Health Insurance Program, CHIP, has provisions for preventive dental services which have been shown to reduce cavities in children. Health education. Policies must include health education initiatives that inform the public about oral hygiene practices. The Oral Health Literacy Act aims to improve public understanding of oral health issues. These policies collectively contribute to reducing disparities in oral health outcomes and enhancing overall community health. Identify and discuss the role of community dental hygienists in addressing disparities in oral health access and outcomes. What strategies can they implement to improve these disparities? Answer: community dental hygienists play a crucial role in bridging the gap in oral health disparities by implementing targeted strategies such as education and outreach. They can organize workshops and health fairs in underserved communities to educate individuals about proper oral hygiene practices, emphasizing the importance of preventive care. Collaboration with local organizations. By partnering with community organizations, dental hygienists can expand their outreach efforts, ensuring that educational resources and dental services reach marginalized populations. Advocacy. They can advocate for policies that increase funding for community dental programs and support legislation aimed at improving access to care, such as mobile dental units that reach rural areas. Culturally competent care. Implementing culturally sensitive practices helps build trust within communities, ensuring that diverse populations receive equitable dental care. These strategies can significantly reduce disparities in access to oral health services and improve outcomes. MS. Rodriguez is a dental hygienist tasked with designing a community dental program targeting low-income families. What steps should she take to identify the population's needs and resources, and how should she evaluate the program's effectiveness post-implementation? Answer: MS. Rodriguez should take the following steps. Needs assessment, surveys and interviews. Conduct surveys to gather data on oral health knowledge, attitudes, and practices among low-income families. Focus groups. Organize focus groups to gain insights into barriers to accessing dental care, resource identification, community mapping. Identify existing dental services, local health organizations, and community resources that can support the program. Stakeholder engagement. Collaborate with local health departments, schools, and nonprofits to leverage additional resources. Program design. Develop educational workshops focusing on preventive care, oral hygiene practices, and access to services. Evaluation plan. Outcome measures. Establish clear metrics such as changes in oral health knowledge, increase in dental visits, and reduction in dental caries rates. Follow-up surveys. Conduct follow-up surveys 6 months after the program to assess knowledge retention and behavioral changes. Data analysis. Use statistical tools to analyze the data, comparing pre- and post-program outcomes to determine effectiveness. By following these steps, MS. Rodriguez can ensure that her program is tailored to the community's needs and effectively evaluated for success. How can dental hygienists critically appraise dental literature to inform their practice? Discuss the steps involved in the appraisal process. Answer: critical appraisal of dental literature involves several key steps. Formulate a clear question. Start with a specific clinical question using the PICO population intervention comparison outcome framework to structure the inquiry. Search for evidence. Utilize databases like PubMed, Cochrane Library, and professional journals to find relevant studies. Assess study quality. Evaluate the study's design, e.g., randomized controlled trial, cohort study methodology, sample size, and potential biases. Check whether the study follows ethical guidelines and has received institutional review board approval. Evaluate results. Analyze the results and their relevance to the clinical question. Look for statistical significance, confidence intervals, and effect sizes. Consider applicability. Assess how the findings apply to your specific practice setting and patient population. Synthesize evidence. Combine the evidence with clinical expertise and patient preferences to make informed decisions. This structured approach ensures that dental hygienists utilize the best available evidence to enhance patient care. What statistical tools can be used to assess oral health outcomes, and how do they contribute to public health decision-making? Provide examples. Answer: several statistical tools are crucial in assessing oral health outcomes. Descriptive statistics. Tools such as means, medians, and standard deviations summarize oral health data, providing an overview of population health status. For instance, calculating the mean DMFT, decayed, missing, and filled teeth score helps identify overall oral health trends. Inferential statistics. Techniques such as t-tests and ANOVA are used to determine if differences between groups are statistically significant. For example, comparing oral health outcomes between populations with different socioeconomic statuses can highlight disparities. Regression analysis. This tool assesses relationships between variables, such as the impact of education on oral health behaviors. A logistic regression model could predict the likelihood of dental visits based on income and education levels. Data visualization. Graphs and charts make complex data more understandable, helping policymakers visualize trends and disparities in oral health outcomes. Using these tools enables public health officials to make informed decisions, allocate resources effectively, and develop targeted interventions to improve oral health. Discuss the systemic factors contributing to disparities in oral health outcomes among different populations. What strategies can be employed to address these disparities? Answer: systemic factors influencing disparities in oral health outcomes include socioeconomic status. Lower income levels often correlate with reduced access to dental care and preventive services, leading to higher rates of oral diseases. Education. Lack of education can result in insufficient understanding of oral health practices and preventive measures. Cultural barriers. Cultural beliefs and practices can impact attitudes toward dental care, resulting in lower utilization rates among certain populations. Geographic location. Rural areas often lack dental providers, creating barriers to access. Strategies to address these disparities include policy advocacy. Advocate for policies that expand Medicaid and provide funding for community dental programs targeting underserved areas. Community engagement. Involve community members in program development to ensure cultural relevance and acceptance. Mobile clinics. Implement mobile dental clinics to reach remote populations. Evaluate the role of integrated healthcare delivery systems in promoting oral health. How do they enhance collaboration between dental and medical professionals? Answer: integrated healthcare delivery systems (IEDS) play a vital role in promoting oral health by fostering collaboration between dental and medical professionals. Key aspects include holistic patient care. IHDS allow for a comprehensive approach to patient health, recognizing the links between oral health and systemic conditions, e.g., diabetes, heart disease. Coordinated care ensures that patients receive consistent messaging about the importance of maintaining oral health. Shared health records. The use of electronic health records facilitates communication between dental and medical providers, allowing for better tracking of patient health and history, thus ensuring continuity of care. Interprofessional collaboration. IHDS promote teamwork among healthcare providers. For example, primary care physicians can screen for oral health issues during routine checkups and refer patients to dental providers when necessary. Public health initiatives. Collaborative programs, such as those focused on maternal and child health, can incorporate dental screenings and education into prenatal care, leading to better health outcomes for both mothers and children. What are the critical components of a successful grant proposal for community dental health initiatives? Discuss how adherence to funding guidelines influences the likelihood of securing funding. Answer: a successful grant proposal for community dental health initiatives should include clear objectives, define specific, measurable objectives that align with the funder's priorities, clearly articulate the problem the initiative aims to address, needs assessment, provide data that demonstrates the need for the program within the community, utilizing statistics and research to support claims, detailed budget, outline a comprehensive budget that includes all projected expenses, justify each item and demonstrate cost effectiveness. Evaluation plan. Include a robust evaluation framework that outlines how the program's effectiveness will be assessed. Specify both qualitative and quantitative metrics for success. Sustainability plan. Explain how the program will continue after the funding period, detailing plans for securing future funding or generating revenue. Adherence to funding guidelines is critical, as failure to follow instructions can lead to immediate disqualification. Each funding organization has unique requirements regarding format, length, and content, and compliance with these standards enhances the proposal's credibility and improves the chances of securing funding. Discuss various data collection methods utilized in public health research. What are the advantages and disadvantages of each method when applied to oral health studies? Answer: several data collection methods are commonly used in public health research, each with its advantages and disadvantages. Surveys. Advantages: cost-effective and can reach a large population quickly. They provide quantitative data that can be analyzed statistically. Disadvantages: response bias and limitations in depth of information collected. Self-reported data may not accurately reflect true behaviors or conditions. Interviews. Advantages: provide rich, qualitative data and deeper insights into individual experiences and perceptions related to oral health. Disadvantages: time-consuming and may not be generalizable to larger populations. Interviewer bias can affect responses. Focus groups. Advantages: foster discussion and allow researchers to explore attitudes and beliefs in depth. Disadvantages: dominance of certain individuals can skew the data. Results may not be representative of the broader population. Clinical assessments. Advantages: objective measurements of oral health status, e.g., caries prevalence, provide reliable data. Disadvantages: resource-intensive and may only capture data at a single point in time, missing changes over time. Each method must be chosen carefully based on the research question and the population being studied to ensure that the data collected is relevant and valid. What is the significance of systematic reviews and meta-analyses in the field of dental hygiene? Explain the methodology involved in conducting a meta-analysis and its implications for clinical practice. Answer: systematic reviews and meta-analyses are significant in dental hygiene as they synthesize existing research to provide robust evidence on clinical practices. The methodology for conducting a meta-analysis includes: define research question, clearly articulate the question following the PICO format to ensure specificity. Comprehensive literature search, conduct a thorough search of multiple databases to identify all relevant studies applying inclusion and exclusion criteria. Data extraction, Systematically extract data from the included studies, noting sample sizes, intervention details, and outcomes. Quality assessment. Assess the quality of each study using standardized tools, e.g., Cochrane risk of bias tool to evaluate the potential for bias. Statistical analysis. Use statistical software to analyze the data, calculating pooled estimates of effect sizes, e.g., odds ratios, mean differences, and assessing heterogeneity among studies. Interpret results. Discuss the findings in the context of clinical implications, highlighting areas where evidence supports specific practices and identifying gaps in the literature. The implications for clinical practice are profound, as meta-analyses provide evidence-based recommendations that can guide clinical decision-making, improve patient care, and inform policy development. Explain the role of epidemiology in assessing the prevalence of oral diseases in different populations. What specific epidemiological methods can be employed to monitor oral disease trends, and how might these methods influence public health policy? Answer: epidemiology is critical in understanding the distribution and determinants of oral diseases within populations. Key methods include cross-sectional studies. These studies assess the prevalence of conditions at a specific point in time, providing a snapshot of oral health in a population. Longitudinal studies. By following a cohort over time, these studies can identify changes in oral health status and the factors influencing these changes. Surveillance systems. Continuous monitoring systems, such as the National Oral Health Surveillance System, NOSE, allow for the collection of data on oral diseases, contributing to the understanding of trends. Public health policies may be influenced by findings from these methods, guiding resource allocation for preventive programs, determining areas for further research, and shaping educational campaigns targeting at-risk populations. For instance, if a significant increase in periodontal disease is noted in a specific demographic, targeted interventions can be implemented to address these disparities. Differentiate between primary, secondary, and tertiary prevention strategies in dental hygiene. Provide an example of each type of prevention as it relates to oral health. Answer: primary prevention aims to prevent disease before it occurs. An example is community water fluoridation, which reduces the incidence of dental caries in the population. Secondary prevention focuses on early detection and intervention to prevent disease progression. An example includes routine screenings for periodontal disease to catch it in its early stages, allowing for timely treatment. Tertiary prevention involves managing disease post-diagnosis to minimize complications and restore function. For instance, providing restorative care to patients with severe caries to restore tooth function and aesthetics represents tertiary prevention. These strategies illustrate the continuum of care within dental hygiene, emphasizing the importance of proactive and reactive measures in maintaining oral health. Discuss the significance of behavioral change theories in tailoring oral health education programs. How can the health belief model and the trans-theoretical model be applied to enhance patient compliance with oral hygiene practices? Answer: behavioral change theories provide frameworks for understanding how individuals make health-related decisions. Health belief model. This model posits that individual behavior is influenced by perceptions of susceptibility, severity, benefits, and barriers. In oral health education, dental hygienists can assess a patient's beliefs about their risk for periodontal disease and use this understanding to encourage preventive behaviors, such as regular brushing and flossing. Trans-theoretical model. This model outlines stages of change: pre-contemplation, contemplation, preparation, action, and maintenance. By identifying which stage a patient is in regarding their oral hygiene habits, practitioners can tailor interventions. For instance, a patient in the preparation stage may benefit from a detailed action plan for integrating flossing into their daily routine. Applying these models enhances patient compliance by addressing specific barriers and motivations, ultimately leading to improved oral health outcomes. A dental hygienist is preparing to collaborate with a patient's physician regarding a referral for a suspected systemic condition related to periodontal disease. What key elements should the hygienist include in their communication to ensure effective interdisciplinary care? Answer: effective interdisciplinary communication should encompass patient history. Provide a brief overview of the patient's dental and medical history relevant to the suspected condition. Clinical findings. Clearly articulate the clinical findings observed during the dental examination, such as signs of periodontal disease and any related systemic health concerns. Implications of findings. Discuss the potential implications of the oral findings on the patient's overall health, emphasizing the link between periodontal disease and systemic conditions like diabetes or cardiovascular disease. Request for collaboration. Clearly outline what is needed from the physician, whether it be further evaluation, diagnostic tests, or shared treatment plans. Follow-up plan. Establish a follow-up mechanism to assess outcomes and refine the care plan based on interdisciplinary input. This approach fosters a collaborative atmosphere, ensuring comprehensive patient care. MS Thompson is a 45-year-old woman who recently moved to a new city. During her first dental hygiene appointment, she expresses concern about her oral health due to a family history of diabetes and heart disease. What strategies should the dental hygienist implement to address MS? Thompson's concerns while promoting her oral health. Answer: the dental hygienist should implement a multifaceted approach. Health history assessment. Gather comprehensive information about MS. Thompson's medical and dental history, specifically focusing on her family history of diabetes and heart disease. Patient education. Educate MS. Thompson on the links between oral health and systemic diseases, particularly how periodontal disease can impact overall health and potentially exacerbate conditions like diabetes. Customized oral hygiene instructions. Tailor oral hygiene instructions to address her specific risks. For instance, emphasize the importance of proper brushing and flossing techniques and how these practices can mitigate her risk of periodontal disease. Nutritional counseling. Provide dietary recommendations that support oral health, such as limiting sugar intake, which is crucial for both oral hygiene and overall health, especially concerning her family history. Referral for medical evaluation. If appropriate, suggest that MS. Thompson consult her physician for a comprehensive evaluation of her risk for diabetes and cardiovascular diseases. How do socioeconomic factors influence oral health disparities within communities? Discuss how dental hygienists can address these disparities in their practice. Answer: socioeconomic factors such as income level, education, and access to healthcare significantly impact oral health outcomes. Lower-income communities often experience higher rates of oral diseases due to limited access to dental care, lack of insurance, and insufficient health literacy. Dental hygienists can address these disparities by community engagement, participating in outreach programs that provide free or low-cost dental services to underserved populations. Education and advocacy. Educating patients about available resources for dental care, including sliding scale clinics and government programs that assist low-income individuals. Culturally competent care. Developing culturally sensitive educational materials that resonate with diverse populations, thus improving health literacy. By recognizing and addressing the socioeconomic determinants of health, dental hygienists can play a crucial role in reducing oral health disparities. Describe the principles of motivational interviewing and how they can be effectively utilized in patient interactions to promote adherence to oral health regimens. Answer: motivational interviewing is a patient-centered counseling style that encourages behavioral change by helping patients explore and resolve ambivalence. Key principles include expressing empathy. The dental hygienist should demonstrate understanding and acceptance of the patient's feelings and motivations, fostering a safe environment for discussion. Developing discrepancy. Help the patient recognize the gap between their current behaviors and their goals for oral health, encouraging them to articulate their motivations for change. Rolling with resistance. Instead of confronting resistance directly, the hygienist should adapt to the patient's responses and use them as opportunities for further exploration. Supporting self-efficacy. Encourage the patient's belief in their ability to change by highlighting past successes and discussing achievable steps for improvement. By applying MI techniques, dental hygienists can effectively enhance patient engagement and adherence to recommended oral health practices. Discuss the importance of screening programs for caries and periodontal disease in community health settings. What are the key components of an effective screening program? Answer: screening programs for caries and periodontal disease are essential for early detection and prevention of oral diseases within communities. Key components of an effective screening program include target population, identifying specific demographics at higher risk for caries and periodontal disease to ensure focused outreach, standardized protocols, developing clear evidence-based guidelines for conducting screenings, including tools for assessing caries risk and periodontal health, e.g., probing depth measurements, referral mechanisms, establishing a process for referring individuals who require further evaluation or treatment to appropriate dental care facilities, data collection and analysis. Implementing systems for collecting and analyzing screening data to monitor trends in oral health and measure the program's impact on the community. Community education, accompanying screenings with educational initiatives to raise awareness about oral health and promote preventive behaviors. How can cultural and linguistic diversity impact the effectiveness of oral health education programs? What strategies can dental hygienists employ to improve communication and educational outcomes for diverse populations? Answer: cultural and linguistic diversity can create barriers in understanding and accessing oral health information. Factors such as language differences, cultural beliefs about health and disease, and varying attitudes toward dental care can affect patient engagement and compliance. To improve communication and educational outcomes, dental hygienists can culturally tailored materials. Develop and utilize educational materials that reflect the cultural norms and languages of the patient population. This can include translated materials and culturally relevant examples. Active listening skills employ active listening techniques to understand patients' perspectives and concerns, which may differ based on cultural backgrounds. Involving community leaders. Partner with community organizations or leaders to enhance trust and credibility, facilitating better engagement with diverse groups. Training in cultural competence. Engaging continuous education about cultural competence to understand the nuances of different populations and adapt approaches accordingly. By recognizing and addressing the unique needs of culturally diverse patients, dental hygienists can improve the effectiveness of their educational interventions and enhance patient outcomes. Evaluate the role of dental hygienists in promoting interdisciplinary care within healthcare settings. What are the potential benefits of such collaborations for patient outcomes? Answer: dental hygienists play a crucial role in promoting interdisciplinary care by collaborating with other healthcare providers, ensuring a holistic approach to patient health. Benefits of such collaborations include comprehensive care. By sharing information with other healthcare professionals, dental hygienists can contribute to a more complete understanding of a patient's health, leading to better treatment outcomes. Improved health outcomes. Collaborative approaches can lead to more coordinated management of patients with systemic conditions, such as diabetes, where oral health significantly impacts overall health. Enhanced patient education. Interdisciplinary teams can provide patients with consistent messages regarding health management, improving adherence to recommended practices across different healthcare domains. Shared resources. Collaborating allows for resource sharing, enabling more effective interventions and reducing healthcare costs through preventive measures. Overall, promoting interdisciplinary care enhances the quality of care and supports better health outcomes for patients, emphasizing the importance of dental hygienists in the broader healthcare context.